safety and efficacy of a new oval chip Phaco Tip in mix. I earned royalties on the device described in this film. Since the beginning of the 21st century, with the description of a new technique for cataract surgery by Jorge Alio and Amar Agarwal, the decrease of incision size and suppression of the sleeve in mix have involved some concerns on the main incision. Robert Osher described in 2005 a new sign of thermal injury, more or less important but completely gone now, with the adoption of micropulse phacoemulsification and CHOP. However, tears of the corneal stroma can occur during the insertion of a 20-gauge round tip into 1.1 mm corneal incision. This is explained by the height sharpness and the inadequacy of the introduction of a cylinder into a flat incision. Dewey in 2006 described a new reduced Phaco Tip to enhance security and avoid capsule breakage. In 2014, Isha Gupta analyzed the efficiency of Dewey Phaco Tip. The risk of capsule breakage is reduced and the use of micropulse longitudinal and transversal US doesn't cause the loss of efficiency or an increase in shutter. But the use of torsional US is not so efficient. In fact, phacoemulsification longitudinal and transversal is essentially due to the jackhammer effect. In the opposite side, torsional relies on a shaving motion with some cavitation effect. There is no injury of incision with this Phaco Tip, but it could be difficult to introduce this smooth but cylindrical Phaco Tip in some circumstances. So we are thinking of designing a new reduced tip with an ovalization of the end. An ovalization and smooth edge shape of the tip allows an easier introduction into the anterior chamber with no injury of the cornea. As previously described in the literature, efficacy was much the same in the first prototype. The cavitation effect remains controversial, and the main outcome in phacoemulsification is jackhammer effect. And a jackhammer doesn't require edge sharpness. Facts were interesting. First, CHOP was easier with Phaco Tip on the side. Second, some leakages occur with this too long oval Phaco Tip during fragmentation close to the wound. This could be dangerous for the iris or capsule by surge effect. If it's important to show, it's better in a scientific way to demonstrate if the ovalization of the Phaco Tip decreases the aspiration flow. With our Phaco machine and micropulse longitudinal, we compare 20-gauge 30-degree cylindrical and oval Phaco Tip. After filling a cup with 25 cc of liquid, we did 4 Phaco aspiration tests lasting 30 seconds each. These tests were renewed with the cylindrical and the new oval tip. The remaining liquid was quantified and the oval tip showed a 7.84% decrease of flow. This slight difference doesn't decrease efficiency in vivo and can increase the chamber stability. So it was decided to design a second version of oval Phaco Tip with a shorter oval segment to decrease leakages. With its thinner extremity, the Phaco Tip can penetrate into the core of the crystalline lens and makes chop easier as chopping a lockdown in the middle. aspiration of epinucleus is safer with this reduced Phaco tip. Finally, this new oval Phaco tip leads to a better introduction into the anterior chamber without corneal traumatism. After the anterior cortex aspiration, the chop is easier with the introduction of the new Phaco tip on the side, at the junction of the first and the second third of the nucleus. You can see at the front of the tip a spontaneous chop. Phacoemulsification has a good efficiency and followability despite a slight decrease of the aspiration flow, but a better stability of the anterior chamber. Moreover, the surgery is safer for posterior capsule, iris and epinucleus removal. This new Phaco tip is available for C-mix and B-mix. And you can see that the incision is really perfect at the end of the surgery.